on. We're gonna come into the room. Hi, Mrs. Farley. My name is Regina. I'm going to be your student nurse today, and we're just going to do a quick assessment. Is that okay?
Yes, thank you, Regina. Nice to meet you.
You as well. I'm just going to use my hand sanitizer. And can you tell me your first and last name and your birthday for me, please?
Laureen Farley, 12/10/61.
Okay, that's what I have on my record. And we just closed the door for privacy. We're just going to be doing a neuro assessment, checking your head and your eyes, your ears, nose, throat, and making sure your reflexes are intact. Does that sound okay?
It does, thank you.
Okay, so overall hygiene, the patient is well groomed and well kept. Her appearance, she has symmetrical face, pleasant affect, and her weight is proportionate to her height. So you told me your first and last name and your birthday already. Can you tell me where you are right now?
Cottonwood Heights, Utah.
And what building are we in?
My home.
And then why are you here today?
Because you asked me.
Perfect, thank you. And what is the date? Do you know what? Without looking. Or can you tell me
March 30th.
what time of day it is outside?
It's 5 o'clock in the evening.
Okay, great. So patient is ANO times 4. She's alert, her eyes are open, and she follows command, so I would say she has a GCS of 15. Can you remember these 3 words for me? Bird, apple, square. Got those? Okay, perfect. And then could you tell me what the phrase kill 2 birds with 1 stone means?
Do 2 things at once.
Perfect. All right. Can you read my name badge out here?
Regina, student nurse.
Great. And how about this right there? Great. Okay. So, can you tell me what those words were?
Bird.
That's okay if you need a minute.
I can't remember. Bird, rock, stone. Bird, something stone.
Okay. If at any point they come to you during this assessment, go ahead and let me know. Okay? So her immediate recall is not all the way there. Her memory is intact and her abstract reasoning is intact. So now I'm just going to, if I had gloves, I would put on gloves now, but I'm just going to inspect your head, okay?
Mm-hmm.
So the head appears normal sized. I would say the head is normocephalic. There are no lesions. Was there any tenderness for you on palpation? It was symmetric. No lesions or scars or anything noted. Your face is symmetric. Your skin tone is appropriate for your race. Your distribution of facial hair is even. Can you pull down on, there you go. Okay, so sclera are white. There's no discharge. Conjunctiva is pink and moist with no discharge. And pupils are 5 millimeters dilated bilaterally. They're even. I'm just going to feel your nose. Are you tender at all? Does anything hurt?
No.
Okay, there's no tenderness noted. I'm also going to press on your face and your cheeks. Tell me if you have any tenderness.
No.
How about up here?
No.
No. Okay, so no tenderness or pain noted. I'm just going to have you tilt your head back for me, please. And so looks like the nares are symmetrical. There's no deviation noted. There's no discharge. And then you can go ahead and put your head back normally. I'm going to have you close one nostril and then breathe in and out of your other one. And and then switch sides for me, please. Okay, so there's airflow through both nares. The left nare is slightly more occluded. I'm going to have you close your eyes and see if you can identify this scent for me.
I smell your hand lotion.
Sorry, that works. Do you smell anything else?
Okay. Do it again. I just smell the hand lotion.
That was my hand sanitizer, Mom. Okay, now I'm just going to look at your eyes. So I'm going to turn off the lights, and I'm just going to have this bright light. You can go ahead and open your eyes for me. Look straight ahead. Okay, and same thing. Okay, so there is constriction of pupils on both sides when the light was shown, and the consensual reflex is intact bilaterally. Focus on my pen for me and follow it with your eyes. Okay, accommodation reflex is intact. No nystagmus noted. The eye movement was smooth. And then I'm going to have you just keep your head straight for me, and when I move, I want you to follow my pen with your eyes, okay? But don't move your head. Okay, so EOMs were smooth and coordinated. There was no nystagmus noted. So that would be cranial nerves 3, 4, and 6. Okay, then I'm just going to put my hand on your jaw. Do you have any pain there?
No.
And go ahead and clench your jaw for me. And then open it back up. Okay, close it again, clench. Do you have any pain or tenderness?
No.
Okay, and then can you tell me if you feel the soft or hard on each part of your face when I touch it, okay?
Hard.
And what side of your face was
Left.
it on? Okay.
Soft right. Soft right. Hard left. Hard right. Soft left.
Okay, great. So the trigeminal nerve, cranial nerve 5 is intact. Can I have you smile for me? And then frown. And then wrinkle your forehead. And then puff out your cheeks. Okay, so cranial nerve 7, facial nerve is intact. I'm just going to look at your ears. I'm going to start by palpating your mastoid. Is that tender at all? How about on this side?
No.
Okay, I'm just going to take a peek. So the pinna is intact. There are no lesions noted. There's no discharge in the left ear. Okay. So both ears were clear. There was no discharge or lesions noted. The mastoid process was untender. And then I'm just going to test your hearing. I'm going to rub my fingers, and with your eyes closed, I'm going to have you tell me which side you hear my fingers rubbing together, like that sound, okay? So go ahead and close your eyes. All right, and tell me if you hear my fingers.
Right side. Left side. Bilateral.
Okay, so the hearing is intact via normal conversation.
Pardon me.
You okay? And the finger rub test. Okay, now I'm just going to have you open your mouth for me. So, and then show me your teeth. Okay, so the lips, the mucosa, the tongue are pink and moist with no lesions noted. Teeth are white. Can you open your mouth for me one more time? And then put your tongue back in your mouth. Okay, it doesn't look like there are any cracked or missing teeth. Okay, and then
No cavities.
I couldn't tell you that. And then I'm going to have you stick out your tongue for me. So the tongue is midline, and then this might be a little bit uncomfortable. Okay, the gag reflex is intact. And at this point, I would take off my gloves. Oh wait. Stick out your tongue and say ah for me.
Ah.
And the uvula is midline. Okay, so now I'm going to put my hands on your shoulders. I want you to push up against them. Okay, I'm going to put my hand on this side of your face and push your face to the left. Or like rotate your head.
Move my head to the left. Turn my head to the left.
Same with this side. Alright, so the accessory nerve is intact. And then hypoglossal nerve is also intact. Now I'm going to palpate your lymph nodes. I'm going to start back here and then let me know if you have any tenderness or pain. I'm going to just press on your collarbones. Okay. I didn't notice any enlarged or firm lymph nodes, and then patient didn't note any tenderness on palpation. Okay, now I'm going to listen to your carotid arteries, and then I'm going to feel. Is that okay?
Yes.
This might be a little cold, I'm sorry.
It's okay.
Okay, so carotid pulses are 3+ out of 4. No bruise noted bilaterally. So now I'm going to palpate the carotid arteries. And the pulse will be 3+ out of 4 bilaterally upon palpation. Okay, now I'm going to look at your neck. And go ahead and swallow for me. And I'm just going to feel. The patient does not have a thyroid. It was removed a few years ago. Trachea is midline. Was there any pain or difficulty with swallowing?
No.
It didn't appear that the patient had any choking or difficulty while swallowing. There wasn't any thyroid rise to observe because she doesn't have her thyroid. Now I'm just going to have you move your neck in all 4 directions. Forward, back, side to side. Let me know if any of that hurts. Can you move your neck any more to the side, left or right?
No, unfortunately not.
Is it stiff for you?
Yes.
Okay, so she has a full neck range of motion. She might be a little bit limited on her lateral movement, but she's been working all day. And then I'm going to have you go ahead and put your hands up for me, and I'm going to have you try and flip them over and back as quickly as you can. Go ahead and go. Okay, great, thank you. So cerebellar ram is smooth, even, and coordinated bilaterally. Go ahead and put up your arms for me. I'm going to push against them, and then don't let me pull them out. Great, squeeze my fingers. Okay, and then I'm going to have you close your eyes and put out your hands. Let me know which finger I'm touching.
My pointer finger, left hand. My thumb, right hand.
Great. Okay, so she has 5 out of 5 strength bilaterally in her arms, and was able to identify correctly which fingers I was touching. I'm also going to have you stick out your hands for me, close your eyes, and I'm going to have you identify what object I place in your hands.
A pen or pencil.
Great. And then in this hand.
A popsicle stick.
Great. Okay, so stereognosis is intact. Patient was able to identify what items I placed in her hands. Now I'm just going to have you do the same thing with your palms up and your eyes closed, and see if you can identify which number I'm writing in your hand.
3. 6.
Great. Okay, so graphesthesia is also intact. Patient is able to identify numbers written into hands. Now I'm just going to check your patellar reflexes. So what I'm going to have you do is I'm going to have you pull on your hands like that. Okay. And then and what did you have for dinner last night?
Meatloaf.
Wonderful. Okay. So patellar reflex is 2 plus out of 3 bilaterally. And then I'm just going to have you cross your right leg over for me. And I'm going to do a quick test. This might tickle a little bit. Oh, sorry. Don't fall off the chair. Okay, and we're going to do this on your other foot. Really quickly, it won't be too much longer. I'm sorry. Okay, great. So there is negative Babinski reflex bilaterally. Okay, and then I'm just going to have you, I'm going to push down on your legs, or hold your left leg up for me and don't let me push down. Okay, and then I'm going to have you go the other way. Perfect. Same thing for this leg. Don't let me push down. And the other way. Great. Strength is 5 out of 5 in the legs. And then I'm going to have you push against both of my feet like gas pedals. Great. And then don't let me, so pull your feet up towards your head. Don't let me push down on them. Great. So strength is 5 out of 5, dorsiflexion and plantar flexion in feet, 5 out of 5 strength. And then I want you to close your eyes and just, I'm going to, tell me which foot or which toe I'm touching on your foot, okay?
My big toe left foot. My little toe on my right foot.
Perfect. Okay, so sensation is intact in the feet. Couple of last things I'm going to have you do for me is I'm going to have you stand up. I'm going to have you walk to the end of the wall. Just go ahead and walk for me. And then on your way back, do you think you could walk on your toes for me? sore from work?
My arthritis.
Alright, and then I'll just have you keep standing. Gait is smooth, even, and coordinated, and the patient is able to perform a specialty test by walking on her toes, although her ankle is sore. And then I'm just going to have you close your eyes for me, and I'm going to have you just stand there and balance the best you can. Okay, great. You can go ahead and sit down for me. Were you able to remember any of those words that I told you at the beginning?
Nope.
That is okay. We are all done with the assessment. Do you have any questions for me?
Square.
Yes, square is one of them. So you were able to identify 2 out of the 3. So
What were they?
Bird, apple, square.
Oh dear, I was way off.
But we are all done. Thank you very much.